Welcome to the Lara Jane Layton Show. This podcast is for you, the person who keeps putting others first. Your self-talk has held you back. You no longer need to take a second seat. Let's explore ways to overcome self-doubt. You can silence that inner bully voice and achieve your full potential. Here's your host, Lara Jane.
Hello, listener. It's your host, Lara Jane. I'm so excited to be here with my new best friend, Marie. All the information about her is in the show notes. This is a subject we all need to be listening to. This is how estrogen affects our self-esteem and our self-talk as women and what we can do about it. So, Marie, help us understand estrogen.
It's a loaded question. Estrogen certainly gets a bad rap. You know, a lot of people are under the impression, doctors and women alike, and the general healthcare profession, that estrogen is bad and that it causes cancer. And the opposite is true. And so there aren't too many people who understand the true benefits that estrogen provides a woman's brain and body, especially when it comes to the way that women speak to themselves or how they feel about themselves, not to mention mental illness and physical function. So I get really excited about estrogen for many reasons. One, because I've seen from a clinical perspective what happens when women get enough of it and when they have too little of it. And also having my own personal experience with being estrogen deficient and then optimizing my estrogen. So it's something I'm very passionate about and something very few people really have the experience of. So yeah, estrogen excites me. It gets me excited like the way people get excited over other things. But yeah, estrogen is definitely is the most powerful hormone a woman has.
Is there a test? Like if I go get my blood taken, I can know if I'm in normal ranges of my blood sugar, of my cholesterol, of my liver, my thyroid, and everything. Are there normal levels of estrogen?
There are ranges. When a woman goes to get a blood test of her estrogen, the reference range that's supplied on that lab test is based off of the average American woman on the standard American diet of that age. So the data that's provided is based off of the average 40 to 50-year-old woman, say, who have low estrogen levels. So when you go get a blood test done, most women will fall into a range. And that's not based off of an optimal range. It's not based off of a young, healthy, reproductive woman. Those levels are towards the upper third of the standard reference range. So if a woman really wanted to optimize her estrogen levels, not to how cruddy the average American woman feels, but for a hormonally sound, estrogen sound woman, those levels tend to go towards the upper third of the optimal range, of the reference range. So those labs are very confusing. Like when a woman goes to a doctor and gets her estrogen lab done, the doctor looks at the labs and says, oh, you're within the range. Well, those ranges are actually set up very confusing to the doctor. If the doctor isn't testing on a specific day of a woman's cycle, if she's still cycling, that's going to affect those levels. So the doctor just puts a woman in a category. So you're either in your follicular phase, your luteal phase, or your menopausal or your postmenopausal. But the doctor doesn't tell a woman where in her cycle to take those blood tests, so they don't really know which range to put them in. So they just stick them in any and just say your labs are fine. Because most doctors, medical school doesn't teach doctors where estrogen levels need to be in order for a woman to preserve her brain and body. So they typically treat the symptoms of hormone estrogen deficiency with psychotropic drugs, treatments, and procedures. So when the doctor says, oh, you're in normal range, the woman says, well, then why do I feel so crappy? Then why am I losing my mind? Then why do I feel so horrible all the time? Why is my body falling apart? Well, I don't know, but here, take this drug or do this procedure and we'll take care of the symptoms associated with your deficiency, but we're not going to restore those hormones.
So how do I know then? If the doctors don't know, how do I find what's good for me?
How a woman feels, really, and going to a doctor who understands where those optimal levels should be. Most doctors don't work with therapeutic dose estrogen to see what happens to the brain and body of a woman when she has enough. And so there are only very few doctors in the country who really understand this. And these are the doctors that think outside of the standard of care medicine model. So a woman, usually women will get low energy, insomnia, joint pain. They'll have an inability to lose weight. They'll gain weight. They'll have gut issues, digestive problems, menstrual cycle irregularity. But they'll also feel really badly about themselves. They'll have a lot of negative ruminating thoughts. They'll have low self-esteem, low self-worth, low self-confidence. They'll feel like a victim all the time. They will procrastinate on doing things because they don't believe in themselves. Their executive function declines. They can't make decisions. Their coping skills are in the toilet until they'll go to the doctor and complain about these things. And then the doctor will put them on medications, usually psychotropic drugs, a cocktail of them, and try to manage those symptoms without truly addressing the cause of what's going on. And
so how do I find a whole life doctor that would know how to figure that balance out for me?
Well, that's the tricky part, because these doctors don't, stand up and wave big flags and say, here I am, I can balance your hormones, for a couple of reasons. One, everybody uses hormonal balance as the term hormonal balance as a term to sell supplements to manage the symptoms of hormonal imbalance. Well, let's just define the term balance. People just use that term to sell things, and it really bothers me because they can't define hormonal balance. Hormonal balance means that all of the main sex hormones, estrogen, progesterone, testosterone, thyroid, those hormones are flowing through the blood at optimal levels. Each one, regardless of where the other hormones are. So women typically do best when estrogen is hovering somewhere in the 350 to 550 range. Progesterone works best in women when it's somewhere, depending on where you test in your cycle. Typically, the optimal level of progesterone is somewhere between 21 and 25 if tested on day 22 of a cycle. If tested in the follicular phase, then it's a bit lower. Well, it's actually much lower, somewhere between 5 and 10. So unless a doctor has the education and training and clinical experience to see for themselves that, well, my patients are doing best when I can get their estrogen in this range. I have no more complaints of headaches or migraines or low energy or insomnia or lack of coping. So it really does take a unique physician. And these are the doctors I work for and train. So I'm a hormone practice consultant, and I train physicians how to prescribe hormone replacement therapy that allow women to reach those optimal ranges in the hormones. So once a doctor sees for themselves, oh, well, when my patient's hormones are in this range, they no longer complain about these things. Well, there aren't too many physicians that aren't afraid of estrogen enough to say, hey, what is that therapeutic dose? How do I therapeutically dose estrogen so I can increase those levels so my patient stops complaining about these things? Medical school doesn't even teach doctors low dose hormone therapy. But if a doctor goes to, say, get an education at a facility like the Institute for Functional Medicine or the American Academy of Anti-Aging Medicine are the two most popular places for hormone therapy education, they're only taught low dose therapies. And when women are given low dose estrogen, it stops working after a while because the brain and body require more than what these low dose patches and transdermal creams supply. And they stop working after a while because they fizzle out the receptors. So when women take a or like they get on a patch for the first time, they'll feel good. They're like, oh my gosh, this is so wonderful. I have some estrogen. My brain is working. But then this diminishes in a short period of time because it doesn't provide enough estrogen to be sustainable. So it'll fizzle out receptors similar to pain meds after surgery. So, you take after a surgery, you'll take a Vicodin, say after surgery, and you'll need 2 in a couple of days or in 3. And you keep upping your dose because the receptors burn out and it stops working. And it's the same thing with low dose hormones. So when women say, oh, it worked for me for a while, but it stopped working, this is why.
How does the imbalance, which is the wrong word, how does the wrong level of hormones affect my self-esteem? How can it make me all of a sudden like myself?
Honestly, without using the word just magic.
I use that one a lot.
Well, it's like that because, when estrogen declines in a woman, which is usually, it begins somewhere in the early 30s for women, that's when women start to go through perimenopause. Perimenopause is not a state, it is a state, it's a condition, just like menopause is, that's brought on by estrogen deficiency. Women who have plenty of estrogen never experience perimenopause or menopause. And you can sustain that for as long as a woman chooses to, till she dies, actually. But when I give hormone replacement therapy, hormone instruction for a patient, I explain to them how to take the hormones. And I also talk to them about some of the things they're going to experience when they start taking it, the moment they give themselves the injection or take their hormones in another way. I let them know it's going to happen within an hour, within a day, 2 days, a week, a month, 3 months. Because when women have enough estrogen, it completely changes how her brain functions. It changes the serotonin levels. It affects dopamine. It affects oxytocin, and it optimizes those hormones. See, estrogen is the main sex hormone in women that dictates how everything else in the body functions down to the nucleus of every cell. So every cell in the body is dependent upon estrogen, and the neurons will stop firing when estrogen declines. So one of the first things that happens when women take estrogen, like when I tell a patient, text me in about an hour and tell me what you're experiencing. Most women don't wait for an hour. In fact, I don't even some women I tell what they should experience, but I tell them, contact me. You tell me what's going on. So I usually get a call somewhere in 30 to 40 minutes or a text saying, oh my gosh, what is going on with my brain? The fog has been lifted. The clouds are gone. My brain is clear. This is crazy. Is this what's really happening? Or is this a psychosomatic effect? Like, am I just thinking this is happening? Why do I feel good for no real good reason? And nothing is affecting this mood change. So estrogen really affects the moods of women and how they feel about themselves. And when you feel good about yourself all the time, every day for no real good reason, and it's consistent and dependable, then women have a tendency to build self-trust. They can depend on who they are, and they start to actually discover who they are. They start to feel good, and they start to feel like the women they are on the inside, that they know that they are, that nobody gets to know because they're so busy dealing with the mood swings and the mood issues and the low self-esteem and the self-criticism, the self-sabotage and the self-doubt, because they feel good all the time. And when I experienced this for the first time, there were so many things going on in my brain, like anger, not anger at the world, but anger that, is this really all I needed? Like to feel good. I like myself. I like who I am.
I need antidepressants and all that stuff. I just needed estrogen.
Yeah. Well, I was put on a lot of, throughout most of my life, since puberty, I was put on psychotropic drugs because of my mood swings, my low self-esteem, my low confidence, my irrational behavior, my crying spells, my inability to cope, not being able to get out of bed or function. I mean, I've lost jobs and friends. My when I was in the luteal phase, right around my period time. And so when I finally got enough estrogen and I saw that the mood swings were gone, my moods were stable. The things that would normally piss me off weren't pissing me off anymore. The things that would trigger me didn't. And then what I noticed was other people were noticing me and how I was responding and acting and behaving. And they noticed that they no longer had to tiptoe around me or be careful with the things they'd say around me. And when I noticed that this became very consistent in how I felt, and I felt good, my self-esteem was up like it used to be in the follicular phase, like around day 12 and 13 day 12, 13, 14 of my menstrual cycle. But this was stable all the time. And then when people would notice it, they would say something. And I'd say, yeah, I'm taking hormones. And they're like, well, how long is this going to last? And that was my question. How long is this going to last? And in the beginning, I was very nervous because I wasn't sure how long it would last because it was so life-changing. I was like, I could live like this. Is this what life is like all the time? And I was asking some of the doctors I worked with in the clinic, my job as a clinical hormone coach is to tell women how they're going to feel on the hormones, how to take the hormones, what their experiences are going to be. But when I started on hormones, I thought, well, that's not going to work for me.
But it did.
All good for you.
And you're talking about this magic and I want some. Do you have a list of doctors I can go find?
Well, I do if they work through me because we work together in tandem because balancing hormones is more than just taking hormone therapy. One, you need to know how to use it. You need to know how to take it. And it's a process over a period of time as the body adapts to the receptors, as it's a titration adaptation process over a period of time. And the woman has to be relatively healthy to get the effects of it. So I help women prepare for therapeutic dose hormone replacement therapy. And then I refer them to a doctor that I've either trained or that has had the same training as I have, who knows how to prescribe hormones in this process. You don't just load a woman up of estrogen. It has to be given in incremental amounts so the body can adapt, the receptors can adapt to that dose. And then so there's a dosing change that happens over a period of time. And as the body adapts to it, then women get more and more benefits of it. So like say, if you give a woman, this isn't a real dose, but if you give a woman like 100 milligrams of estrogen in the beginning, she's not able to fully utilize that dose because she doesn't have enough receptors to do that. So her body will respond in a positive way and sometimes in a negative way. The negative ways are like women will get breast tenderness or they may get bloaty until they develop the receptors for that dose. And so this changes over time. And this is part of the clinical coaching that I do to coach women through this process. So yeah, there is a list that I work with, but there's a preparation and a collaboration that takes place between the hormone coach, the physician, and the patient. We kind of work together in a menage a trois type of situation where I triage the patient. The doctor's there to write the prescriptions for the hormone replacement therapy, but the hormone coach takes care of the triaging and the instruction and coaching the patient through the process. So yeah, I wish I can just say, go to this doctor, but it doesn't necessarily work that way.
Okay. So because I know our listeners are very excited about this, because I'm thinking that some of the signs of burnout that I went through probably weren't as much that I was physically drained, but maybe my hormones were messed up and that I wasn't able to respond helpfully. And go ahead.
Yeah, that's most likely the case. Women start to lose their estrogen in their early 30s and their brains start to change and they start to notice that they can't tolerate the things that they used to, or they feel like they just can't cope. They can't take on those pressures anymore. And their executive function begins to decline. They can't make decisions like they used to. And some have never been able to do that at all. Most women have no idea what it's like to live one day with adequate levels of estrogen running through their blood. They're typically put on birth control pills and antidepressants at a young age, and that puts women in chemical menopause. So when women are in chemical menopause for their young life, and then they decide they want to have babies, they get off of hormones, they get off of the birth control, and somewhere in their 30s, when the ovaries have been shut down for a while, the ovaries aren't used to producing adequate levels of estrogen and progesterone. And if they're lucky enough to get pregnant, then right after pregnancy, then the ovaries shut down again because, well, at that point, the ovaries are like, hey, this is when I check out. So most women spend the majority of their lives with broken ovaries. They don't really know what it's like to feel good. And even in this next generation, my latest field of research is in, why do young women have these menstrual cycle issues from the beginning? Years ago, women would have regular, healthy menstrual cycles, and it wasn't until their mid-30s that they started to have menstrual cycle irregularity, which, by the way, is the number one indicator of estrogen levels. So when you say, how do I know if my estrogen is deficient? Well, it's the quality of the menstrual cycle that will tell you. But part of the problem is young women are born with broken ovaries. They don't have healthy functioning ovaries. Women are handed down the health of their ovaries from the mother, and it's transgenerational. So my latest field of research is this transgenerational inheritance of ovarian dysfunction. So my mother gave me her broken ovaries, who got her broken ovaries from her mother, who got her broken ovaries. So every year there's been a cumulative effect on this ovarian dysfunction. So in this generation, Generation G and even Generation Z and even Generation Alpha ahead of us here, these young women will never, ever experience life with healthy functioning ovaries, healthy functioning menstrual cycles. And that's what doctors should be taught. It's the health of that menstrual cycle is directly correlated to estrogen levels.
So if someone no longer has menstrual cycles, like whether surgically parts are removed or they've already passed that menopause that they could have avoided, how then do you know if you're having a healthy level?
Well, because I've been doing this so long and it's been a part of my research, I've been a clinical hormone coach for over 20 years, and I've been researching this for probably about 18 when I started to notice that as hormones are getting to optimal levels, the clinical indicators in women change. So I started to measure the symptomology of women coming into the practice, to the clinic. So when estrogen is, say, in the 100 to 200 range, women feel a certain, they score a certain, I have a clinical indicator assessment, and I monitor 50 clinical indicators, that the top 50 that women complain about the most. And these score from 0 to 4. So the total highest score is 200 if they scored all 4s. So I noticed as estrogen levels increased up to a certain point, well, when they increased, that clinical indicator score came down. The scores that were, say, 4s when they came in, when they had low estrogen, and I test once every 4 months hormone levels and take a clinical indicator assessment, the more optimal estrogen became, the lower the score became. So this is how I would know, well, most women do best in this range. This is how we got this number. So when women are in the 100 to 200 range, then the scores are somewhere between, 150 and 100. When estrogen became more optimal in the 350 to 550 range, that score was suppressed down to 20 or below. But also what I found out was, well, it happens if you give them more, because that was me. I want more. It's like, I feel good here and my score is low, but can I feel better if I increase that level? And the answer is no. When you give women more estrogen than what her brain and body need and require, she'll have negative symptomology that's different than what she had when she was estrogen deficient. So there is too much estrogen. And I'm talking about adequate dose estrogen therapy, not high dose. People who prescribe low dose hormone therapy, anything higher than low dose to them is high dose. But there is adequate dose and there is high dose. And so the goal is to get into that hormone sweet spot, which I've been able to figure out. Well, most women tend to do best when estrogen is circulating in the blood somewhere between 350 and 550. Though some women require a little bit more to get that clinical indicator score down. But boy, once you reach up there in the 600 to 700 range, women don't feel good. And that's how we knew to bring that down, bring the hormone levels down. Okay, bring it down here back into this range where we can get a good clinical indicator score. And this is how we figured out, where the optimal range is.
Are there any herbs or non-prescription type ways that people can add estrogen, or is it all a shot from the doctor?
Well, there's just different ways to administer estrogen. The body doesn't care how it gets estrogen. It just wants it. So whether a woman produces it, and that's the goal. That was the goal 15 years ago. When a young woman would come in with menstrual cycle irregularities, we'd put them on a protocol, a diet and a lifestyle protocol to stimulate ovarian production. Then we would test labs in 4 months to see if we have a result. And if they had an increase closer to optimal, then we would do that again for another interval and test again. And then we would get those levels up into the optimal range. But we can't do that anymore. The ovaries are just broken. And now we just don't waste time. When young women come in, our goal is to get those estrogen levels optimal. There is nothing on this earth that replaces estrogen like estrogen. No phytoestrogen, no synthetic estrogen. There's nothing that replaces estrogen like giving yourself estrogen if your body isn't able to produce it. So really, you really have to restore it. And most doctors, they don't restore it, and they either give supplements to try to manage the symptoms, but the patient's still in a state of deficiency. So it's this exercise wheel of treating the symptoms of estrogen deficiency with expensive supplements and ineffective testing. And, when you restore estrogen in a woman, there are very few mental illness conditions to manage and physical decline. So when you say when a woman has reached that, who've already gone into menopause, you can restore estrogen in women to regulate a healthy menstrual cycle. See, a menstrual cycle and a period are two different things. A woman's body still cycles even if she no longer has a period, right, even if she's had a hysterectomy, because you can feel it in your body. There are 4 stages of postmenopause. Each stage is marked by lower and lower estrogen levels. The first 2 stages is relatively easy to reverse that menopause. And this is where menopause reversal comes in. So you can give women enough estrogen and progesterone that tells the brain and body she's really in a reproductive prime. And that's what the signaling is. So women who are in their reproductive prime, the messaging is, well, the estrogen levels are somewhere between 350 and 550. That's what helps regulate the menstrual cycle. Like me, I'm 59. But my hormone levels tell my body I'm really in my reproductive prime. I will never enter menopause in my lifetime. And so women are like, well, why would I want to do that? Why would I want to have a period? Well, most women's period. Funny you should ask. So I know we talked about this. Why would I want that? My periods were horrible. Well, that's an indicator of how long you've been estrogen deficient. Because women who have healthy levels of estrogen and progesterone running through their blood have incident-free periods. And we just don't hear about that anymore. We hear about PMS, we hear about blood clots, we hear about cramps, we hear about mood swings, migraines, headaches, inability to cope, depression, anxiety, negative ruminating thoughts, low self-esteem, inability to cope. Well, that typically happens in the luteal phase of women's menstrual cycles because that's when estrogen is the lowest. And then after a woman has her period, when the estrogen increases in the follicular phase, they feel good. And they go to the doctor saying, well, I felt good 2 weeks ago, but I feel like crap now. Oh, well, you're bipolar. And now they're getting medication. Well, no, actually, it's the estrogen just crashed way too low, or they didn't produce enough estrogen in the follicular phase to trigger ovulation, which is when the body produces the bulk amount of progesterone. That's the other regulator for the menstrual cycle. So without enough estrogen and progesterone, a woman can't maintain a healthy menstrual cycle. So the goal is to restore the hormones in a way that tells the brain and body that a woman is really in her reproductive prime. So there are no headaches or mood swings. The goal is to have an incident-free period for life or a menstrual cycle. So if a woman has had a hysterectomy, you can still restore the hormones that tells the brain a woman is in her reproductive prime, not aging out. So it actually preserves the mind and body of a woman. So her brain isn't falling apart. This is why the executive function comes back, the ability to make decisions, the creative thought, the ability to meditate, to get into that state of meditation so that you can be this creative force and to be able to create the life a woman wants. It's just, it's crazy. And then this is where I got angry when I was just like, so this is all I needed. So now I have my brain, or I couldn't even say I got my brain back. I got a brain because I had always been estrogen. I'd always had horrible menstrual cycles. So where you give woman hormones and she has, her periods are, she has mood swings and that sort of thing. Well, those are clinical indicators that she just still doesn't have enough estrogen. And then we adjust the hormones until those go away. We want to bring that negative clinical indicator score down. And that's dictated by estrogen levels mostly.
When you do this, do you look at all the hormones or just primarily focus on estrogen? And when that's in balance, the rest just seem to work?
Yes and no. Well, you take a panel, but keep in mind that every single hormone in a woman's body is dependent upon adequate levels of estrogen to function right. So a woman who has thyroid issues also has estrogen deficiency issues. And thyroid is very closely related to estrogen levels. When you optimize one, you balance one, you have to balance the other. So there is an intimate relationship between estrogen and all the other hormones. But it's just ridiculous to try to balance progesterone, testosterone, thyroid, cortisol, any other hormones without first addressing estrogen because it's strong influence off, the clinical efficacy of any HRT that a patient takes. So we first start with the two main sex hormones, estrogen and progesterone, and we get those hormones balanced out. Then we take another look at testosterone and thyroid, because when you optimize estrogen and progesterone, all the other hormones want to perform better because the brain is under the impression that a woman is in a reproductive prime and the brain and body have to be healthy enough to reproduce, even though women aren't able to reproduce. Once you're out of eggs, you're out of eggs. But the brain is under this impression, well, I have to stay healthy and strong. So the bones dense up and there's a reversal of osteoporosis. That's just crazy. And this was probably when I started monitoring the bone density scans with estrogen and the clinical indicators. I'm like, this is just nuts that this is so, easy. Mm-hmm. It's not that difficult. Once I train a doctor, the overall concept of what we're trying to achieve, and then teach them the clinical application process of how to achieve this, it doesn't take long for a doctor to see with their own eyes the reversing of the deterioration of the female body, where the things start to regulate digestion. I want to talk about gut health. Estrogen is such a powerful gut healer and regulator of just absolutely everything in the brain and body. It's fascinating. It's why I talk about it so passionately. But like I said, most women don't get adequate levels of estrogen because doctors are taught to be afraid of it. You keep a doctor afraid of estrogen, they won't prescribe it and they'll talk patients off of it. And I think that this stems, in my research, I found that just stems at medical school intentionally keeps doctors in the dark about how to fully restore hormones. Because if you fully restore hormones in women, especially estrogen, there are very, very few mental illness diagnoses, just very few. I'm not saying that estrogen cures mental illness, but it's pretty darn close. At least the doctors can get rid of the mental illness associated with estrogen deficiency and other hormone deficiencies. And then whatever true mental illness issues are there, if they're there, then they can be treated effectively. But most mental illness diagnoses that women have are directly related to estrogen deficiency.
I always thought that women have kids while they're young it's because that's when they still have the patience for it. But it sounds like if we kept our hormones balanced, you could have them anytime. Maybe we'd be more patient with our grandkids or the neighbor's kids or.
Well, it's the body. The body is really designed naturally to have children right when we start menstruating. And our society wouldn't allow that. But years ago, when women started their periods later and got married younger in their late teens, this is really how the bodies are designed to function. And we have children at young ages. Yeah, we have enough estrogen because we can tolerate it. We have the energy and we have the wherewithal to take care of them. We don't have the wisdom, but that's what mama was for. And that's what grandma was for, because it took a village, and it takes a village to raise children. We're not supposed to raise children one-on-one. We're not supposed to be single moms. That's not how we were created. Our brains and bodies are designed to raise children in a community. And so the young women were left to pop out the babies. And it was the wise old women that really nurtured and cared for those children. And, but now women are put on birth control pills and antidepressants thinking, oh, well, we can just wait until our 30s. Or really, well, that's when your brains and bodies are falling apart. You may be able to have a child in your 30s, 40s, and even 50s. But if you don't maintain those hormone levels, you won't want those children. In fact, women who have children in the mid-30s and beyond really struggle with their brain and their patience and their coping skills. In fact, most of these women, a lot of women who are in perimenopause who have children, they don't like their children. And they feel very guilty for not liking their children or wanting to get away from them. They end up trying to set up their days so they can spend as little time as possible with their children because they just can't cope around them. They don't like them. Not only that, they don't like to be touched. They don't want to talk to anybody. They just want to be left alone because they feel so miserable. And they usually end up going, I get a lot of women that talk about becoming, I feel like I'm an alcoholic because all I want to do is just have a glass of wine just so I can cope with my family. Well, you get a little estrogen on board, you forget about the wine because now your brain and body is able to cope and you're not falling apart and you're loving and you want to be touched and you're nurturing. Women without estrogen, they're not nurturing. They're curt, they're irritable, they're moody, they're inconsistent, and children pick up on that. I mean, I went through that myself. My children walked on eggshells around me and I knew it. And it bothered me because I knew that they were careful because of me. And that bothered me because it created a disconnect with my children. So much so that when I got on the hormones, my kids were wondering, who are you? They weren't sure what they were going to get. Well, before they didn't know.
Where'd mama go?
And it was, and I saw how much it affected them. And when I got on the hormones, I told them, I said, listen, because they were just like, Mom, my daughter said, well, I noticed that she was very careful with how she was telling me this. I can see her kind of stuttering, worried to tell me that I was nicer because she didn't want to piss me off. What are you talking about? I'm nice. I do love you. Okay, you can hug me for a second, but then don't touch me. And then when my children noticed that I wasn't having mood swings, I was nicer, I was loving, I was nurturing, I wanted to be around them, I was hugging and loving all over them. And they were like, who, they didn't know who I was. And I sat them down and said, listen, those hormones I'm always talking about, when I drag you into the clinic and at my conferences, this is what it does for women. I'm calm and I'm consistent. And when I walk through the door, you won't have to guess who I am anymore. This is me. This is what estrogen and progesterone do for a woman. It calms the brain. It makes me happy. I feel like I'm the mom I want to be to you. And I was able to have conversations with my children and explain to them why that they can depend on me. And it was life-changing for my entire family. Even the pets noticed. I mean, it's crazy. Even pets pick up on these moods and they come around. And my children now became more loving towards me. They were hugging me more because they knew I wasn't going to bite their head off. they knew I was going to hug them back. They knew that I would be in a problem-solving mode if they had problems, instead of saying, well, I guess you created yourself a big mess now, didn't you? It's like, good luck.
Oh, that's crazy.
It really is. And it's why I wanted to talk about these things, because women need to know that they have a choice. They do not have to mentally and physically decline, and they do have a choice. And it's not psychotropic drug cocktails like I was put on at a very young age. And when I realized that my mental illness wasn't on my mental illness, I had about a dozen mental illness diagnoses until I got on estrogen, and I was put on psychotropic drug cocktails for years. That my next line of treatment, my doctor told me that this is it for you. This will stop working like the rest of them, and then we'll need to consider shock therapy and other things. And I was in my early 30s when I was told this.
Oh my gosh.
And I'm just like, I cannot live my life like this. This is crazy, because I don't feel mentally ill. So when I finally got enough estrogen, to say it was life-changing is an understatement. And I haven't been on a psychotropic drug cocktail since I got enough estrogen and progesterone. And that's when I know. So your question is, how does a woman know? It's how you feel. If you feel like you're a mess, if your brain isn't working, if you have low self-esteem, low self-confidence, if you can't cope, if you feel like that you're not the woman you are on the inside, if you feel like a shell of a woman, then chances are your estrogen is low and it needs to be optimized. And the best thing you can do is learn about estrogen and how it works and functions. Because if estrogen really caused cancer, Laura, then all young women, when estrogen is high, would be getting cancer, and not women who lose estrogen when they're older. And we produce extremely high levels of estrogen when we're pregnant. And then if estrogen caused cancer, pregnant women would have a lot of breast cancer. But as long as doctors are afraid of estrogen and don't educate themselves on estrogen, and that it's estrogen deficiency that make women sitting ducks for cancer and other diseases and mental illness diagnoses, they would say, okay, well, teach me, how do I optimize estrogen in my patients so my patients won't have mental illness and their brains and bodies won't fall apart. And I'll have answers for them when they ask me, why do I have headaches all the time? Why do I have migraines? Why can't I lose weight? Why do I feel crazy all the time? Why do I behave this way? I mean, estrogen is the best behavior modifier, mood stabilizer, happy. Estrogen is the happiness hormone. It's crazy to feel happy every day for no real good reason, knowing that nothing's going to bump you off track, that you can handle it and cope. So yeah, that's why I come out of my seat when I talk about it, because it's not that difficult. It's just, and that's where I am in my career now. I'm mostly working with physicians to train them how to do this, because they're like, there's something to this. I'm giving my patient patches, but they're asking me for more, but I don't know what to do. And this is what the doctors I was working at in the clinic I was working in, they're like, my patients are asking for more estrogen. How high can I go? I'm like, well, let's see. And that's when I started to monitor the clinical indicators, and where we found that sweet spot. There is a sweet spot for estrogen, and most women have never reached it.
Amazing. I got to get on this. And I want to always feel on the inside what I feel. I don't know if that makes sense.
Oh no, it
you just kind of something just, I have a hair trigger at some things that I just like, not dealing with this ever again. And it would be nice to just let those roll off. Just not worry about them, because they're no big deal. There is no big deal.
Yeah, and it's very difficult to do without estrogen. And the things that aren't a big deal turn into huge deals. And women will have just meltdowns over nothing. And you're like, oh, wow, what is that all about? And then, and then 2 weeks later, when she's producing more estrogen, she's a completely different person. And, and people treat you like, that was me. It's like, and then people say, well, what's your problem? We're just melting down, and we're just horrible. And the things that can come out of these women's mouths, mine included, it's hard to hard to take some things back.
Yeah, that's true.
It really is.
Once they're out there, they're gone. Yeah, you can be nice, the damage happened. You can rebuild, but the damage happened.
Estrogen really is the family stabilizer and the relationship stabilizer. Without estrogen, women have a very difficult time being the woman that they know that they are on the inside. And it makes it for a very lonely existence. Women without estrogen aren't lonely. Estrogen deficiency creates a lot of loneliness for women. It's very isolating. You give a woman estrogen, she's not lonely. She's able to cope. She knows who she is. She can develop into the woman that she knows that she is. So it's such a powerful hormone that I'll spend my dying day advocating for adequate levels of estrogen, just because when you see with your own eyes what happens and feel what happens, it's quite life-changing.
We are going to do two things. We're going to take a quick break.
All right.
A word from our sponsor, but we're also really close to the end of time. So when we come back, what I really want to know is how I and my listener get our doctor on this plan. How do I get this help? So we'll be right back.
This podcast is sponsored by Lara Jane Coaching. You know you're ready to silence your inner bully voice. Let Lara Jane support you with coaching. To schedule an introduction call, go to larajanelayton.com.
All right, Marie, I got to know this, because as much as I think my life is beautiful and sweet, and there are moments when I know I'm out of control, and those would be great to not have to feel bad through, because it kind of makes you feel like, oh, look, I've done all this work and here I go again. Back. So I have great doctors. But how do I get them to get on the plan so that I can do this?
Well, conventional doctors aren't very open to it. Functional medicine doctors, anti-aging doctors are more open to it. They focus more on men's hormone therapy because it's easier. But you'd have to, a conventional doctor, unless your doctor's really open-minded. Do you go to a conventional doctor?
I have a regular MD that I go to that I just love. There's also a DO there.
DOs tend to be more open-minded because of their education.
I've thought about switching, but mine's so good, I don't dare.
Well, good at what? Managing your symptoms? And that's the thing, is their training and mindset is standard of care medicine of treating the symptom with a drug or a procedure.
I think for me, it's because he truly makes me feel like he cares about my overall health. And like he does his research, he tunes in, and I know he would be open to it. I just don't know what it would take to get him on the bandwagon.
Well, I do. PanaceaSciences.com is where I would refer a doctor. And that's what I'll give the listeners. Doctors who are interested in hormone balance training, they can go to hormonebalancetraining.com. There aren't too many people that offer female hormone replacement therapy training. And I'll mention that. And I'm actually one of the very few that do, because there just aren't too many people who've tried because doctors are just so afraid, because they'd be afraid of estrogen. Oh no, how high do I get the hormones? Well, we've already done all that. We know how to do it. We know where to start the patient and how to titrate that dose up over time, when to monitor labs, and how to get there. So yeah, if a woman wants their doctor to learn more, then I would have them go to hormonebalancetraining.com.
And if we want to know where we could go, is there a list of where we could contact you and find someone in our local area? Or
yeah, I work with telehealth physicians. And so if a woman wants to get her hormones balanced, she can work together with me as a team with a hormone doctor that I'll refer her to based off of her clinical challenges. Some women have thyroid issues. Some women have weight issues. And so I refer to the doctor that I think would best help them in that particular situation. And that would be femalehormonebalancing.com.
So it doesn't even have to be a doctor near me. I say, hey, Marie, I'm hiring you.
Yep.
Help me. And then you and I work with a physician that you choose out of your network. And
Yep.
it's all tele. So I don't have to go anywhere.
Nope.
But I have to go somewhere for a lab works.
Yeah. And I'll order those labs for you. We'll review those labs. I talk to you about those labs and where those levels should be. And then send those labs and all the paperwork that I get from you, your female history, your medical history, the medications you're on. I send all that paperwork over to the doctor. The doctor takes that information and puts together a plan, meets with the patient and puts together a protocol, sends me over the plan, calls me up and says, hey, thanks for the referral. Let me tell you what we're doing. And then we put a plan together. And so now we're working together in a three-way relationship. And that's kind of how it works.
I think I have hope. It's like, oh, maybe there is more to what can be done for a pretty normal person to actually start feeling more normal.
Yeah. And what tends to happen when women lose estrogen is they tend to adapt to feeling crappy and they have no idea how good they can actually feel. And they start getting a taste of it and their body and brain start to change and wake up and function better. And women, yeah, you can certainly feel when your estrogen's low. Because in the beginning of the titration process, women will feel good in the beginning, but they'll start to not feel good in a couple months because their brains and body require more. And as a coach, that's how I work with you and your doctor saying, okay, at the end of this interval, do we increase the dose now or do we wait and take labs? So this is how we work together, is getting the patient enough of the right hormones at the right time until we get to that hormone sweet spot.
So you're not all screwed up in your head. You just got to balance your own.
Yeah, I'd like to tell you something. Not like women have been told. I mean, women have been told that a lot. And because that's what the doctors believe and that's what they've been trained to believe. But when a doctor is trained on therapeutic dose hormone replacement therapy for women, they see for themselves the crazy that goes away and that the patients are coming off of their medications. Not only does a lot of mental illness diagnoses just fall away, but so does high blood pressure, high cholesterol, type 2 diabetes. These women just don't have these conditions anymore because those conditions are so strongly influenced by estrogen. So when I say estrogen affects every function in the female body every cell is dependent upon estrogen. And so when you give a woman estrogen, and especially at therapeutic doses, the brain says, I have to be healthy. I've got to pop out babies. I've got to be around. I've got to have my wits about me, even though they don't. It's like, this is where the brain is in a woman's reproductive lifespan. So if a woman's brain is always under the impression that she's healthy and she needs to reproduce, then the body will try to mimic that as closely as possible. So there is this reversal that takes place when you're reversing menopause for women over a period of time where the body is trying to change shape. It's trying to mimic a more youthful body. So the muscle tone comes back, the fat drops off, the curves come back, the libido comes back.
I really need this stuff.
Because when you lose estrogen, it's like, okay, I've got to survive. That means I have to fatten up because I have to live off of this and lose my mind, which means that there is an adaptation that takes place in the brain of accepting the fact that you're aging. So and then society does not expect as much out of old women because they know they're not going to get enough. They're not going to get a lot. So society treats women differently when they're old. And so when you bring back estrogen and the brain and body are coming back and the women are talking like they know what they're talking about and they're not forgetting what they're saying and they have good cognition skills and they can articulate the things that they think. Well, then society treats them differently. Oh, okay, you're not an old lady. You actually can communicate with me and I can actually ask you for directions and you're not going to fall apart when I say something. It's interesting how the hormone levels tell the brain where a woman is in her reproductive lifespan. And it changes how we interact with our world and the people that we live in this world with.
Yeah. And I know that this is TMI.
There's no TMI here.
Since my hysterectomy, I put on over 200 pounds. And I fight with it all the time. I eat healthy. I eat low calorie. I eat low carb. I eat not like I look. And if this would be that magic pill that would put the shape back in the 8 instead of the 0.
Yeah. Well, yeah.
That would be amazing.
I use this term, though it's kind of, some women get offended by it. I live in Chico, California, which is a farming community. And every farmer here knows that the quickest way to fatten up a pig for slaughter is to remove the ovaries. So when women lose their estrogen, they lose their ability to burn fat. And the brain of the woman now is like, I've got to fatten up to survive. Because now women are producing estrogen in their fat that keeps them from going absolutely nuts. So the estrogen levels dictate. Estrogen is the best fat burner for women, and it's the best gut healer, the two most important things in shaping up the body is gut health and hormone levels. And so, yeah, if a woman wants to lose weight and clean up the gut to help lose weight, the best thing to do is to optimize the estrogen. And that's part of the program that I've put together for these physicians. It's like, yeah, there is a way to lose weight, and estrogen. And that's one thing that's missing from a lot of weight loss programs and especially these hormone balancing programs. Hormone balancing programs, they don't address estrogen. And other hormone coaches, they don't talk about estrogen. They talk about cortisol, insulin, progesterone, and that's what they mean by hormones. Estrogen is the main sex hormone that dictates all those other hormones. So to continue to ignore the main sex hormone in women makes it a real struggle when you go to these hormone weight loss programs. It's like, but they're not addressing estrogen. So if a woman really wants to lose weight, she needs to go to a hormone coach who understands how to optimize estrogen to reshape that body physically, muscle tone, and fat loss. And not to mention the libido. I mean, honestly, having a libido and a sex drive is just, it puts a spring in a woman's step. And she sends out a pheromonal exchange if she's open for business.
I'm open.
Well, the estrogen will help send out that pheromonal exchange that the community gets. Not only the pheromonal exchange that happens with estrogen is not only a sexual pheromonal exchange, but it's a community pheromonal exchange that even allows young women to be receptive to even talking to an older woman. That there's just this glow and this presence about an estrogen sound women that happens that estrogen deficient women don't have. And it makes it a lot easier to live in society when people aren't ignoring you or treating you like you're just a nuisance. And why are you here? And walking around you and avoiding looking at you. When a mature woman gets enough estrogen on board, people make eye contact. And even young people flirt. It's like, are you flirting with me? I mean, it's like, it's the difference between night and day, really, with the libido. And it's really nice to feel good and to feel wanted. And to feel sexual, whether you're sexual or not. It's just estrogen's a feminizing hormone. It's a sensuality hormone. It just really allows women to just really be in her feminine prime and gives her just this feminine power like nothing else. It's such an incredible hormone. Like I said, I will probably spend my dying day talking about this hormone because nobody else is talking about it the way it needs to be.
You're doing a great job. You've convinced me completely. I am on your calendar soon.
Well, I'm happy to help you out.
All right. We've definitely spent our time. Hopefully you didn't have a hard stop because we went right over it.
No, and I really am grateful, Laura, for you to, be open to talking about this and to talking to me about this. And I really appreciate the platform and all the hard work that you do, getting information out for these women and helping them just find their strengths. And I just really enjoyed your website and your podcast. And I encourage all of your listeners to continue doing so.
Well, thank you. And I definitely think we need to have a comeback. After I've got on the therapy and we're back, we can talk about the differences.
Oh yeah,
wouldn't that be like awesome?
It really would. It really would. We'll start from the beginning, and and just within the first hour, and you can talk to me about how your brain is crazy, feeling good.
It remembers shit again.
I know. Yeah. Not only that, I just feel good. Am I going to feel good like this all the time? Yeah, actually, you will. Get used to it.
Oh, I'm very hopeful. I am very excited. I'm glad that we had this conversation. I know the listener is like, tell me how to get a hold of you, Marie. I need to talk to you. And it is in the show notes, but why don't you tell them one more time in case they're driving and they don't want to click on show notes, they can remember it.
Well, they can go to menopausemoxie.com and go to my website, and they can book a free consultation on just about any page. This isn't for everybody, but it's for most. So just book a free consultation. If you have lab work, I'll go over that with you and explain to you where you are with this. Not everybody needs hormone therapy, but most do. And it certainly isn't a sales pitch. If this isn't for you, it's not for you, but they can go to menopausemoxie.com.
I love it. I will be visiting menopausemoxie.com before the end of the day.
Thank you.
So thank you.
Book a free consultation. Let's talk about your situation.
Okay, that sounds great. We're so out of time. I'm a little bit frazzled trying to close this out, but I don't want to. I want to keep talking to you. So we're going to close it out. Thank you so much, listener. I am not a medical professional. I am here for entertainment. I'm always so grateful when I have someone with such knowledge come and join me on the show. So stay tuned for the next episode. We'll talk to you in a minute.
Are you tired of waking up exhausted? You are not alone. If you're looking to take your life back, let's start with the simple step of adjusting your self-talk. Stay tuned for the next episode with your host, Lara Jane. Remember to follow the show so you don't miss the next simple step that you can use to feel more confident. And please leave an honest review.